1. A pharmacy must notify the State Board of Pharmacy of a change in ownership within a. 5 days, b. 10 days, c. 30 days, d. 60 days. 2. The pharmacist in charge PIC is typically responsible for a. Only financial operations, b. Inventory only, c. Ensuring regulatory compliance, d. Marketing services. 3. Which personnel is authorized to perform final verification of dispensed prescriptions? A. Pharmacy technician, b. Intern pharmacist, c. Licensed pharmacist, d. Pharmacy clerk. 4. A pharmacy intern may perform the following under direct supervision except a. Counsel a patient, b. Compound a sterile product, c. Final check on dispensed medications, d. Take verbal prescription orders. 5. In a centralized prescription processing model, the originating pharmacy must a. Notify patients and obtain consent, b. Outsource all clinical services, c. Avoid using shared databases, d. Use only manual processes. 6. DA Form 222 is used to a. Order Schedule II substances, b. Transfer Schedule IV drugs, c. Dispose of expired OTC drugs, d. Notify theft of controlled substances. 7. A prescription for a Schedule II controlled substance must be a. Called in by the prescriber, b. Handwritten or electronically prescribed, c. Refilled up to 5 times, d. Good for 12 months. 8. Which DA schedule allows verbal prescriptions and up to 5 refills in 6 months? A. Schedule 2, b. Schedule 3, c. Schedule 1, d. Schedule 5. 9. A partial fill of a Schedule II prescription for a LTCF patient must be completed within a. 7 days, b. 30 days, c. 60 days, d. 90 days. 10. Which of the following activities requires DEA registration? A. Administering vaccines, b. Dispensing non-controlled prescriptions, c. Prescribing antibiotics, d. Dispensing controlled substances. 11. Which of the following is a required label element for all dispensed prescription drugs? A. Patient's SSN, b. Manufacturer name, c. Prescription number, d. Referring physician. 12. A prescription is considered valid if it is a. Pre-signed and completed by a nurse, b. Written for a legitimate medical purpose by an authorized prescriber, c. Issued by a friend, d. Written but not signed. 13. The maximum number of refills allowed for Schedule III medications is a. 0, b. 3, c. 5, d. Unlimited. 14. For non-controlled prescriptions, how long after the date issued are refills valid? A. 3 months, b. 6 months, c. 1 year, d. 2 years. 15. Emergency dispensing of a Schedule II drug is permitted under which condition? A. The prescriber is unavailable, b. The pharmacist has prior approval from the DEA, c. Immediate administration is necessary and no alternative is available, d. The patient requests it urgently. 16. A pharmacist who suspects prescription forgery should a. Fill the prescription but notify the patient's doctor. B. Refuse to fill and notify law enforcement or appropriate authorities. C. Ignore it unless repeated. D. Fill it to avoid conflict. 17. Which federal law mandates child-resistant containers for most prescription drugs? A. FDCA. B. Poison Prevention Packaging Act. C. HIPAA. D. OBRA 90. 18. HIPAA allows disclosure of PHI without patient authorization for a. Research only. B. Employment screening. C. Treatment, payment, and healthcare operations. D. Family requests. 19. Which act created the Schedule 1V Controlled Substance Classifications? A. Durham-Humphrey Amendment. B. Controlled Substances Act CSA. C. Kefauver-Harris Amendment. D. Drug Listing Act. 20. Under OBRA 90, pharmacists are required to a. Offer drug counseling for Medicaid patients. B. Substitute brands automatically. C. Call prescribers before refills. D. Provide samples of new medications. 21. Controlled substance inventory records must be kept for a minimum of a. 1 year. B. 2 years. C. 3 years. D. 5 years. 22. How often must a pharmacy conduct a controlled substance inventory? A. Monthly. B. Quarterly. C. Annually. D. Biennially. 23. Loss or theft of controlled substances must be reported to the DA using a. Form 106. B. Form 222. C. Form 41. D. Form 224. 24. DA Form 41 is used for a. Theft notification. B. Registration renewal. C. Ordering controlled substances. D. Destruction of controlled substances. 25. Which records must be maintained separately from all other pharmacy records? A. OTC sales. B. Controlled substances Schedule 2. C. Insurance claims. D. HIPAA acknowledgments. Multistate Pharmacy Jurisprudence Examination. The Multistate Pharmacy Jurisprudence Examination (MPJE) is a pharmacy law examination developed by the National Association of Boards of Pharmacy (NABP). It is designed to assess a candidate's knowledge of both federal and state-specific pharmacy laws and regulations. The MPJE is a requirement for pharmacist licensure in most U.S. states and jurisdictions. The test combines aspects of law, ethics, and regulatory standards that govern pharmacy practice, including controlled substances, licensure requirements, prescription regulations, and record keeping. Administered as a computer-based exam, it evaluates a pharmacist's ability to apply legal principles in real-world scenarios, ensuring public safety and legal compliance in the delivery of pharmaceutical care. Here are the top 5 beneficial uses of the sample exam. 1. Licensure requirement. The MPJE is a mandatory exam for pharmacists seeking licensure in most U.S. states, ensuring they understand and can apply both federal and state pharmacy laws. 2. Legal competency validation. It verifies a pharmacist's knowledge of pharmacy jurisprudence, promoting ethical and legal compliance in practice. 3. Mobility across states. Passing the MPJE in multiple states allows pharmacists to practice legally in those jurisdictions, supporting career flexibility and broader employment opportunities. 4. Protection of public health. The exam ensures pharmacists are prepared to follow legal standards that safeguard patients and prevent misuse of medications. 5. Professional integrity. It reinforces the importance of legal accountability in pharmacy practice, fostering trust between pharmacists, patients, and regulatory bodies.